Good evening. My name is Adyana Bosch, and today we're presenting my custom research project, Criminal Behavior and Mental Illness, a forensic psychology perspective. Now I'm going to share it. 1 second. Right, here it is. All right. So this presentation will explain the relationship between mental illness and crime, the role of forensic psychology, and recommendations for improving how the justice system addresses these challenges. There is a strong connection between criminal behavior and mental illnesses. Forensic psychology plays a central role in understanding this relationship. For example, some conditions like schizophrenia or bipolar disorder, especially when untreated, can contribute to criminal actions. This study examines how mental illness and crime are linked and how treatment and the law address this issue. Prevalence of mental illness in criminal population. High prevalence of severe mental illness among incarcerated individuals. That's Catlett Leaf, 2015. Research shows severe mental illness is more common in jail and prison compared to general public. In fact, 20% the individuals in jails and 15% of those in prison live with serious mental illness. This is compared to just 5 to 7% in the general population. One of the biggest problems is too many incarcerated people with mental illness does not receive a proper treatment. Psychological and environmental factors both play a role. For example, childhood trauma or neglect often increases the risk of antisocial behavior. Disorder like psychopathy, and sociopathy both fall under the antisocial personality disorder called APD. At the same time, environmental issues like social exclusion and exposure to violence also raise the likelihood of crime. Mental illness and criminal behavior. Specific disorders such as schizophrenia and bipolar disorder may contribute criminal action that left untreated. Substance abuse makes this even worse, increasing the risk of violence. It is important to understand that mental illness does not automatically cause crime, but when combined with other risk factors, it really raises the changes. Predisposing, the next slide, predisposing factors to crime by the mental ill. Other predisposition factors include homelessness, poverty, lack of access to consistent healthcare, and past trauma. These challenges often overlap, making rehabilitation and treatment more complicated for mentally ill offenders. Psychological assessment and treatment. For forensic psychology assessment. Forensic psychological assessment are very important. Psychologists are a structured tool to decide if someone is competent to stand trial. They also determine the best treatment plan. Treatment often includes cognitive behavior therapy, goals accessibility, medication, and social support. These combined approaches are more effective in rehabilitation. The legal system considers mental health when looking at competency and the insanity defense. For example, someone might be found not competent to stand trial or legally insane at the time of the crime. These cases are difficult because they raise questions about fairness, responsibility, and morality. Ethical dilemmas. Forensic psychologists face ethical dilemmas, like balancing treatment with community safety. They must also avoid bias, especially in legal cases, and handle difficult questions like involuntary treatment. These ethical challenges make forensic psychology a very demanding profession. The morality of using psychiatric labeling too much in order to evade punishment is something that also is an ethical dilemma for the forensic psychology. Therapy and recovery methods. Several treatment methods are used for mentally ill offenders. Cognitive behavior therapy, CBT, helps change harmful thought patterns. Moral recognition therapy focuses on improving moral reasoning. Other methods include crisis intervention teams, mental health courts, and diversion programs that direct people away from prison toward treatment. A psychodynamic theory formulated by Sigmund Freud, which emphasized unconscious motivation in childhood. This theory focused on emotional neglect and parental rejection to initiate a future act of aggression. This theory is useful but also criticized because it is hard to specifically prove. Behavioral theory. Cognitive behavioral therapy argues that crime is learned behavior. If someone grows up in a violent environment, they are more likely to repeat their behavior. Behavioral therapy such as CBT help offenders unlearn these harmful behaviors and replace them with prosocial ones. Cognitive theory. Cognitive theory is centered on irrational thinking patterns and distorted belief. Cognitive distortion may be caused by mental illness such as schizophrenia disorder or bipolar disorder. Criminal behavior results from distorting thinking, making it defined right now and run complicated. This theory is instrumental in forensic because it focuses head on the perpetrator thinking. Brain anomalist. Biological theories look at brain structure and genetics, emphasize what this element of poor neurological functioning does to behavior. The amygdala may contribute to aggression and emotional processing capacity that leads to reactive violence. Neurobiological perspective help illuminate the biological basis for some crimes. Genetic predisposition. Genetic predisposition may also make some individuals more vulnerable, thought genes interact with environment and do not determine destiny. Genetic discovery are not deterministic, but must be employed as a risk factor in assessment treatments. Social learning theory. Social learning theory by Bandura explained that people learn crime by observing others. If crime is seen as normal in someone's environment, they may adopt it as acceptable. Treatment under this model focuses on teaching and modeling healthier behavior. Strength theory. According to strength theory by Merton, social inequalities give rise to crime as the inability to attain societal goals drives individuals toward crime. Strength theory helps forensic psychologists determine the effects of environment stressors on mentally ill offenders. The integrated biopsychosocial model. The biopsychosocial model combines all these perspectives. It shows that crimes among mentally ill offenders usually result from a mix of biological, psychological, and social factors. This model is helpful for designing treatment plans that address the whole person. Rehabilitation should have a holistic treatment plan which addresses the entire person. Research design. My research design involves forensic psychologists, mental health professionals, and incarcerated individuals. It used a qualitative approach with interviews and focus programs conducted over 6 months. The goal was to find recurring themes in how mental illness related to crime and criminal behavior. The result, prevalence and impact. Several mental illness present 20% of those incarcerated in 15 prisons. That completely confirm what I said before. Substance abuse disorder that occur tend to enhance violent crime. Schizophrenic and bipolar disorder are mental illness that result in criminal activity with no treatment. And forensic psychology emphasizes specialized treatment on mentally ill offenders. Insufficient mental health treatment in prison is associated with increased recidivism, from Hussein in 2020. Key finding: criminal behavior associated with mental illness, particularly in treating mental illness such as schizophrenia and bipolar disorder. The role of forensic psychology is vital as it is related to assessment and treatment with people who experience mental illness. Offenders with mental illness need a biopsychosocial rehabilitation program. Recommendation: longitudinal studies show follow mental ill offenders to assess the long-term effects of mental illness on crime. Studies on effectiveness on cognitive behavioral therapy, CBT, and mirror recognition therapy, MRT, to reverse recidivism in mentally ill offenders. Work on integrating mental health care better in the criminal justice system. So we must carefully balance ethical concern while performing the justice system to better support mental ill offenders. Conclusion: forensic psychology is significant in ascertaining the relationship that exists between the diagnosis and mental ill and criminality. Ethical issues surrounding involuntary treatment and competency assessment may be treated delicately. And research and reforming the system mental health services with the criminal justice system must be undertaken further. Okay, so here are the references used in this project. Thank you very much for listening to my presentation. God bless you. Okay.